Okay, so for the next type of incontinence, we'll be looking at what is known as stress incontinence. All right, stress incontinence. Now, we actually looked at urge incontinence. We said it's also known as urgency. So for this stress incontinence, it's quite different. Okay, so this is images trying to show the different types of what incontinence, and we are focusing on the stress. And for this image, they say that the stress incontinence is due to what? Increased abdominal pressure, or probably you're under stress. Okay, so that stress incontinence is indeed a common form of urinary incontinence, especially among women. It is characterized by the leakage of urine during activities that increase pressure on the bladder, like squeezing, sneezing, laughing, or lifting heavy objects. Now, it's common amongst women because, yes, the urethra in women is not really long. You understand? It's not really long, so you have all these problems. So causes could be that there's some weak pelvic muscles. All right. So maybe from childbirth, maybe surgery, maybe aging. All right. There could be urethral with sphincter deficiency, could be some hormonal changes. Okay. Symptoms if you're having urine is leaking out during physical activities. Okay. So there's involuntary urine loss when engaging in activities that increase abdominal pressure. There's limited bladder control. So there's difficulties holding in urine during sudden movements or exertions. Okay. Diagnosis is mainly what? Medical history and what? Physical examination, just to assess for the symptoms and potential causes of this. Alright, then you can also do urinalysis to rule out that okay, there's stress incontinence but there's no infection, right? Then urodynamic test just to evaluate bladder function, then urine flow. Okay. So treatment is mainly what? Pelvic floor exercises, that's scheduled exercises. This ones will strengthen the muscles that support the bladder. The lifestyle modification, that's weight management, bladder training, dietary adjustment. The medical interventions like devices like what? Pessarates or some surgical options may actually be necessary. So managing of the stress incontinence is you consider incorporating these tips into your daily life management. So you practice what? Kegel exercises. They usually call them pelvic floor. This one, if you're having weak pelvic muscles, they will strengthen your pelvic muscles back. Avoid drinking caffeine and alcohol. This one actually irritates the bladder. Maintain a healthy weight to reduce pressure on your bladder. Use pads or incontinence products for extra protection if needed. Okay, so this is what is known as what? Stress incontinence. The stress is like an external pressure, the external pressure on your bladder. You understand? Okay, that's stress incontinence.